Your doctor is sharing this video with you because you have dry age-related macular degeneration, or AMD. Your eye doctor wants you to know more about AMD because AMD is the most common cause of irreversible blindness as you age and as the disease progresses. AMD affects the macula at the back of your eye, the part of the retina that lets you see fine detail, like words on a page. There are two types of AMD, dry AMD and wet AMD. In dry AMD, yellow-colored deposits called drusen can be detected by your eye doctor during your examination. In wet AMD, abnormal blood vessels grow and can suddenly leak without notice. This will cause permanent vision loss if left untreated. That's why early detection of wet AMD is so critical to preserving your vision. About 85% of people with AMD have dry AMD. About 10 to 15% of people with AMD progress to the more aggressive advanced stage of the disease called wet AMD. When you have wet AMD, your central vision becomes distorted and eventually becomes only a dark area. Severe and permanent vision loss can happen very quickly if treatment is delayed. Because wet AMD damages the macula and can take away your central vision, wet AMD can severely impact your quality of life. It can limit your independence and make many of the activities you enjoy and rely on, like reading, using the computer, driving, and watching television, impossible. Wet AMD develops in people like you who already have dry AMD. The chances of dry AMD advancing to the more severe wet stage increases as dry AMD progresses over time. In some cases, your chances of progressing from dry AMD to wet AMD within the next 5 years can be greater than 50%. It is crucial to detect this progression as early as possible to prevent irreversible vision loss. There are important steps you can take to detect the onset of wet AMD as soon as possible. Along with healthy lifestyle choices and taking AREDS vitamins daily, at-home testing of your vision is key to the earlier detection of wet AMD in between your doctor's visits. There are effective treatments for wet AMD that eye doctors have access to, and after progressing to wet AMD, you will receive treatments to halt the leaking from the abnormal vessels that causes vision loss. Studies have shown these treatments are most effective at preserving your vision and independence when wet AMD is caught early. A delay in treatment means a risk of irreversible vision loss due to wet AMD. That's why catching the progression to wet AMD as soon as possible is so important. It means you have the best chance of maintaining your good vision you rely on every day.